cancer center where they could adequately monitor it. Right?
The thing is that John Ringo's parents had money and could afford it.
His
And
mother
it's-
left for 6 months to a year without anybody else.
Right. I mean, basically,
Lauren said it was crazy. They didn't, she was gone. She just took him. Your father was in that community then?
father was the rabbi of that community.
So do you know Derek? Fine.
No,
He
I
went to
remember
the,
the house.
is it called King David?
His parents used to drive the Jag.
They
His
did.
parents had a Jag, the old school Jag.
So they have a house, right? So we have a circle. They have a house 2 blocks away. John Ringo's still there, he's right. Even though they,
We're your loyal supporters.
You are.
it's tough. We were debating, do people want to come close to Rosh Hashanah?
Yeah, we were actually out with our son and grandkids, so it was fine. We said, okay, we'll have dinner and then from there.
That's
we'll come
good.
Here.
Good,
And I've been cleaning all day, so I needed a break.
Mm,
good.
Okay, I'm ready to start. How about you?
I am, very.
Welcome everyone. Tonight we're discussing medical ethics with regards to research and whether the appropriacy of being able to use data that was collected in unethical behaviors. Let's just call it as with that. So, and I like to start with an extreme behavior, and then we can go from that and play with it. And Dr. DeeDee will go with her part. But the simplest, most relevant situation would be where a doctor goes and actually murders a patient. There's patient A needs a heart, and patient B is sick. The doctor goes and murders patient B, takes their heart, and now we have a heart. Of someone who is murdered? Can we take that heart and place it into patient A who needs a heart? Okay, so we have the heart, we have the person who's murdered.
If it's experimental or just in general?
Just in general,
Okay.
I think that's an extreme case. It's a
Okay.
very extreme case, right? What would you say?
And well, let me ask you this. I mean, as the recipient of another person's organ, are you told where that organ came from? I mean,
No.
how would you even know?
Not always. Sometimes they'll ask if the donor wants to divulge it. It's only if the donor wants to divulge.
Yeah.
Right,
Right, so usually
if the family.
so I think we can start with that of like taking an extreme case and then we work backwards with regards to more relevant cases because and see how other cases would play a role with regards to medical research.
Right. So, I mean, one of the things that came up when I was doing some research for this was, could we possibly use data from Nazi Germany with Mengele and some of the other physicians, right? Could we use that data to then treat other people? So what happened at Boston University was that the library had one of the Nazi Germany anatomy books. And many of them were found, but the insignia of the SS was like airbrushed out. Okay, but they found one at BU that was like a very detail-oriented anatomy book that was written by the Nazis and had an SS insignia still on it. So Rabbi Joseph Pollack, who was actually the rabbi of Hillel and was very heavily involved in ethics, and a guy named Gordon, what's his name? Michael Gordon. They said, can we use this information? Secondarily, what about the information that we can glean around other things? Because the Nazis actually did a few things. They studied anatomy. They wanted to study things that would help their soldiers. So one of the things that they did for their pilots was that they exposed Jews to these like pressure chambers that would kind of simulate high altitudes. Can we use that information to help ourselves if it was done by totally unethical means? So do you want me to tell you what these guys thought? So from an ethics perspective, they actually evaluated the Jewish laws and also just the regular medical ethics of it. They felt, so when they polled multiple Holocaust victims, especially some of those twins that had been experimented on by Mengele, they actually said, some of them said, no, you can't use it. The others said, you should use it because you're now glorifying, you're elevating the deaths of the people who were the victims of this, right? So what they decided at BU was that we can use this information, but there's a disclaimer on it. This unfortunately happened and was given, this information was given to us under unethical means.
So then it gets sort of put
Right.
back in the
Exactly,
person
exactly.
who has to decide.
So that's what BU did. They actually put a big sign on that anatomy book saying this was made by Nazis. Jews were actively hurt in studying this book. You have to understand that. So.
I also heard the idea of non-citation with regards to research. So the goal of that using the research, but not giving any, not accruing
Author.
any author to the research in that, because I think what needs to be done is you want to ensure that something like people don't learn that we don't glorify a certain type of practice. So an unhealthy one, unethical practice should not be glorified in order, so we may use it, like you said, but, to give a disclaimer or to, a non-citation of.
The only problem I have with non-citation is that if I'm a scientist and I'm looking at data, if I don't see a name, I can't use it.
Oh, really?
I wouldn't use it. It wouldn't be acceptable to me if I don't know where that information came from.
That's interesting.
So.
Okay, so let's talk a bit about what people dissecting the dead
Cadavers.
cadavers. No,
Dissecting cadavers.
Okay, so the halachic question that comes up on a regular basis, and it played a major role. Sorry, I think someone's trying to get in. Usually, Eve's trying to get in. Sorry.
Hi, Eve.
So one of the questions that come up on a regular basis is with regards to cadavers. So, for example, someone passed away from a mysterious disease. Are we able to go after they passed away? Are we able to go and analyze their body in order to try and gather information in order to heal the future person who may be sick with that same disease, right? So the prohibition of cutting up the dead, or what's the word?
Nituach.
What's it
That's what you were saying, nituach,
called? Nituach, right?
to dissect.
Dissect. there's a prohibition of, there are two prohibitions. And one is that one needs to one respects the dead, and also the responsibility of burying a person past as soon as possible. The Torah says, there's an actual verse in the Torah that says, one's not allowed to leave a dead person overnight. One should bury them the same day. So by going and dissecting a dead person, a person who has passed, one is going against these two prohibitions. So first of all, can one go and dissect a person in order to study them, in order to save a life? The first question was, well, we do that in practice. For example, if someone passed, we were able to use their organs in order to save other lives. So even though you're going against the prohibition of dissecting the deceased, you're saving a life. So one's allowed to save the life, one's allowed to go against the prohibition in order to save a life. Now the question comes up is, can one do that if one is not necessarily saving a life straight away, but a potential future life? Can one dissect the dead? And with that, there's actually a machlokas, there's a discussion between Rabbi Moshe Feinstein and the Chazon Ish, whether you actually need the sick people to be present so that this will actually currently save the sick person right now, or is it future tense that somewhere along the line, at some point in time in the future, you'll be able to save the life? And the Chazon Ish holds that you're allowed to, you don't need the person to be here and present, but even for future tense. So we kind of have this, also have this concept of being able to, in order to save a life, to do something that is unethical. I mean, cutting up a deceased is an unethical behavior. It's not appropriate to treat, the dead in such a way. So are you allowed to do that? Well, in order to save a life, we believe that you are allowed to do that. And it's really a question of, do they need to be in front of you, or do they not necessarily need to be in front of you? But in order to save a life, one is able to use certain unethical behaviors. And the question is, how far of unethical behavior do we go with regards to saving a life?
Right. I mean, that's talking about a dead person, right? But then the next step is, if you're a live person, can you put yourself under research, in a research situation? Is it halachically permissible, or is it not halachically permissible? Are you sick or are you not sick? Right? So I don't know if you guys know what I do for a living. I do something really rare. So I'm a medical researcher. I'm a gynecologist by training, but I basically do research on healthy volunteers. So what I do is I evaluate, with the help of scientists, new compounds for multiple things like Parkinson's, migraines, infectious disease, oncology medications, right? But some of them have never been given to a human being. So before we give them to sick people, we ask healthy people to come to us only for financial gain, not for therapeutic gain, and live with us. So they live in my unit and they are administered medication, basically. And then we look for adverse events. Now you have to remember that they do put themselves at risk, because I can't always tell you what the target organ or the side effect profile is. And so one of the things that comes to light is the subjects that come to see me sometimes might hide information, right? They might hide their medical history.
All right.
Hi. So sometimes they might hide their own medical history because they would like the financial gain. right? So I actually have to evaluate the ethics of certain things that I do every day. Is it safe for me to administer a drug that might have long-term side effects on a healthy volunteer? Is it safe to take a woman of childbearing potential and expose her to a chemical that I don't know will have long-term effects on herself or an unborn child? But is it okay because these people really need the money also? Right? So you're balancing this. These people come in and they voluntarily want to be in these studies and they're paid for it, right? We do have equations that that have been worked out for many years with the FDA, where we determine the dose that's basically 10 times less than any side effect found in an animal. So we do it in baby steps, but that's what I do for a living. So that's why I thought this was a really interesting topic, because if you really think about it, the ethics of clinical research on human beings all starts with something called informed consent, right? And so there was a famous book written about 10 years ago by this woman named Rebecca. It's called The Immortal Life of Henrietta Lacks.
Oh, right.
Okay, it was made into an HBO series by Oprah, but the story is that basically in 1951, I remember last session I talked about a gynecologist named Howard Jones, right? We talked about, oh, you weren't here. So last session I talked about fertility treatments with Gadi, and we talked about the history of in vitro fertilization. And one of the gynecologists was Howard Jones, remember? And they moved to North Carolina or Virginia, and they started their first Norfolk. They started that first IVF clinic, remember? So Howard Jones had a patient come to him. She was a very poor African-American woman living outside of Baltimore City, but came to Johns Hopkins for treatment. She had cervical cancer. They took her cells and they used her cells in the basement of Johns Hopkins by a scientist who took those cells and grew them in culture. It was the first time ever that they were able to ever take human cells, despite the fact that they had cancer and HPV, human papillomavirus, and grow it in culture. That's how we got all of so many of our treatments today are built off of what we call HeLa, Henrietta Lacks cells. So this woman, her name was Rebecca Skloot, was in a cell biology class, and she heard the name HeLa, and she started investigating who HeLa was. And it turns out that her family didn't even know that there was a multi-billion-dollar industry made from Henrietta Lacks' cells. And they never got a penny from it. They were poor. Some of them were incarcerated. Some of them were homeless. Some of them had no medical insurance. They were all living in Baltimore City with very little care. And they had no idea that their sister and mother and grandmother was dead and that her cells were actually taken. The scientist and the physician actually gained no money from it. It was all done like steps after, once they learned how to grow in culture. And so she explores the idea of ethics is also very much so informed consent.
I have a couple of questions. Excuse me. What are the demographics of the people that come to your study?
Well, they're 18 to 65. So, and we
You're
attempt.
too old, Alan, sorry.
we tried very hard to make it a diverse demographic. So we actually get subjects from California, even Hawaii, Texas, Wisconsin, Illinois. They come from all over. Many of them are career they call themselves lab rats, actually. The ones that come very regularly, they have to eat what we tell them. They have to sleep when we tell them. They cannot go near sunlight. We try to kind of standardize everything, but we try to make it men and women, and we try to have a diverse age group as well as a cultural group. We always try if we can. It just depends on who answers the ads.
but they're not necessarily trying to get money to eat and to live. And what about their educational levels? How is, do they
Well,
really 100% understand what's going on?
Yes, they have to. So there are many times in the United States, actually, more so than Nazi Germany, where we actually experimented on prisoners and the indigent, as well as orphans.
Yeah,
There was,
the Tuskegee syphilis study.
exactly. So we think of Nazi Germany as the first place that had what we call eugenics, where they thought of a specific race as being superior to others. Well, guess what? It was happening in the United States for a very long time. They actually said that the Tuskegee Airmen, which were basically poor Black men, could be exposed to syphilis, right? So they exposed them to active syphilis, despite the fact in 1935, in 1942, we already developed penicillin and we could have treated them, but they opted not to treat them because they felt that they were inferior. Isn't that terrible? They never told, they told the airmen that they had bad blood and that the doctor wanted to treat them with an injection.
It's terrible.
It's a terrible story.
Did you?
Yeah.
And this wasn't like in the 1800s, right?
Right.
This is 1940s.
I know.
And it went on until 1970.
Book cast.
No.
Yeah, that is such.
Cast, C-A-S-T-E.
Yeah. That is
Oh, like in
really
about American caste
such,
system?
Well, yes, and so they looked at America, Nazi Germany, and India. And I mean, the horrifying was that Nazi Germany looked at what was going on here
In the United
America
States.
and our treatment of blacks, and they learned from that.
That's
They
so
used
sad.
that
That is so sad.
in Nazi Germany.
That's so sad. I have to take a look at it.
So yeah, what you was bringing up, yeah, so then the family.
Right. The family has since filed a, and Hopkins actually has given them money. But there's also one of the saddest stories actually that was brought up in Henrietta Lacks. It is so shocking to me. In 1962, okay, there was a doctor, his name was Dr. Chester Southam, who worked for Sloan Kettering in New York City. And he said, I would like to see what happens to older patients if we inject them with active cancer cells. So Sloan Kettering said, get out of here. You should not be doing this here. We don't want you to do this here. Get out. So he goes to Brooklyn and finds a friend of his who's a Jewish doctor, and he convinces him to give 22 Jewish elderly patients cancer cells.
At the Jewish Chronic Disease Hospital.
Yes, Jewish Chronic Disease Hospital. So what happened was, isn't that crazy? So there were 3 Jewish doctors, Dr. Amir Kagan, David Leichter, and Perry Fursko, who basically said, this is 1962. They wanted to do it without their consent. There was no such thing as informed consent at the time. It was still completely paternalistic medicine. So they went to the New York State Board and said, come on, we can't do this. They got a lawyer to help support them. They actually didn't get anywhere until they brought it to the news and had public support. And then it stopped. And that was actually the beginning of the development of informed consent in New York City. But the crazy thing is that Dr. Chester Southam was actually lost his license because of this, but then 2 years later was reinstated and made the president of the American Cancer Society.
Oh,
Is that crazy? It's a really sad, and this is like 1960s. This is not 1800s. Sad, right?
It's great. Okay, I want to talk about Cleopatra.
Yes,
So Cleopatra, there's a fascinating discussion in the Gemara. So we always try and bring resources from the Gemara with regards to can you use research and bring, bring it from a practical perspective, utilize it from a practical perspective. So there's a discussion in the Gemara between one of the Tanaic sages, Rabbi Ishmael, and the rabbis with regards to if the fetus, in the womb, if it develops at the same speed as a female fetus. And the real question was, does it take 40 days or does it take longer? Rabbi Shmuel, he brought quotes from verses and from with regards to the amount of time that a woman who aborts has to be in an impure status. He quotes from that perspective that the female fetus takes longer to develop than a male fetus to develop its complete organs. What the Gemara goes and does is they bring proof from Cleopatra. Cleopatra, the queen of Egypt, was known to take female maidservants, female slaves, who were destined to be put to death because of an action that they had done. She would have them raped and impregnated, and then at a certain date, she would have them cut open, fish out the fetus, and evaluate the fetus.
postmortem.
Post-mortem, correct. And the Gemara goes and says, and Cleopatra, what came out was that they're equal at 40 days. The male and female, they both develop at the same speed at 40 days. So the Gemara goes and brings that as proof to support their opinion, which is against Rabbi Ishmael. And Rabbi Ishmael argues back. He says, "I'm bringing you proofs from the Torah, and you bring me proof from idiots or from simple people."
You say postmortem,
Meaning they'll kill the maidservants and then they'll open her up and find.
So essentially, are you able, if someone's sentenced to death or someone's going to die of a disease, anyway, 100% they're gonna die, could you experiment on them?
And this was done often. I mean, like even in the United States, a lot of medical research was done on prisoners that were like
That's
having lives
terrible.
and they used them as
They would give them
experiment.
live hepatitis B and tell them that they wouldn't tell them there wasn't any consent. So they would give them live hepatitis B and say, you know what, you need to behave. And if you behave well and take this injection that the doctor is going to give you, then maybe we'll reduce your sentence. It was, it was sketchy. And they injected them with live hepatitis B.
They did reduce their sentence.
I don't think so. I think they died.
They died.
Yeah.
They-
Oh,
they refused to-
funny.
Yeah, so we see that in the Gemara they did use unethical. That is clearly an unethical way of behavior. Okay, that was unethical behavior, and they would use that for personal reasons. Another example that was given was that the students of Rabbi Shmuel that went and they dissected a person who had been put to death to count exactly how many limbs he had. What is the
How many joints?
how many joints? What is the correct number nowadays? Do you know? Do they have
I have no
a?
idea. No.
So Rabbi Shmuel said there's 248. He said there's 6 more. They counted 6 more, and they brought him and they said we counted 254. And he argued with them what he counted from a realistic perspective. You clearly don't know how to count. And he said, I'm coming from the Torah's perspective, and the Torah says 248. So the Gemara doesn't necessarily seem, the Talmud doesn't necessarily have an issue with the unethical behavior that was being used. And that is really a question of like, can one go about and use unethical behavior? And we're kind of left. It doesn't.
Because it's also a slippery slope, right?
It's a very yeah. 100%.
Because you might say, okay, this was unethical, maybe we could jiggle it a little so that we could then use the information because it's the good of the people, right?
Yeah.
The good of the populace.
I mean, I would imagine there was, well, medical, you know, that they were interested in being
Actually, it
safe.
brings to mind a very famous one. If you read Ben Carson's book, Helping Hands,
Well,
I read it when I was very little. I'm not a Ben Carson fan. I'm just putting that out there. So Ben Carson,
Why did I like Ben Carson?
he was running for president.
Oh, okay. Fine.
So, and he actually grew up like in a very, very poor area of Michigan where most people were actually unable to read. And his mother said, in order to succeed, you have to get off the streets and you have to read. And then he said he became a neuro. So there's a famous story actually from the hospital I trained in Baltimore at Sinai Hospital. The doctor's name was Phil Goldstein. So there was this woman comes to Hopkins and she's pregnant with twins. One of the babies though has hydrocephalus. The head is too large and the other baby might die or is fine, but they wanted to put they wanted to put a shunt in the hydrocephalus baby in utero. So Ben Carson said, I think I can do this. It was totally experimental. There was never, ever a successful or documented in utero neurosurgery at that time. It was around 1985 in Baltimore. So Hopkins said, you are not touching these women in Johns Hopkins. I'm actually surprised, but that's what Hopkins said. So Ben calls up Phil Goldstein, chief of gynecology at Sinai Hospital, the hospital I trained at. And Phil's like, we're going to do this. And they did it and they succeeded and both babies survived and the mother survived.
Yeah, but what was the procedure again?
It was in utero placement of a shunt to reduce hydrocephalus in one of the twins.
Oh,
Was the baby going to die anyways?
I don't know. I don't know if they could have predicted it. I don't think it was 100% that hydrocephalus
and
baby.
did the mother fully understand?
Yeah, the mother fully understood. She was really actively involved. But the question is, can you do this from a halachic perspective? Can you put yourself in this kind of situation, knowing that there's 3 people that could be affected? Can you? If an Orthodox person came to you and said, could I do this?
I would think that there needs to be a clear and present danger in order for to justify such a behavior. That's clear what we need. We need a clear and present danger.
So what about the first person who got the COVID vaccine in Israel?
But what what is the loss? What is the danger of receiving a COVID?
Well, I will tell you that they hid this.
Tell us.
I hid this.
behind-
They hid this.
behind COVID
No.
vaccine.
No, it has nothing to do with COVID. It has to do with the polio vaccine.
Okay.
There was,
Yeah, now there's a resurgence.
yeah, oh yeah. But there's actually data when I was reviewing for this talk. There's data that says that they knew that there was a cancer contaminant and a polio contaminant in the polio vaccine that the FDA hid in order to treat the entire population. So they knew that, like, I don't remember how many doses. They knew, like, let's say 5,000 doses were tainted that they couldn't necessarily fix or rectify. And they suppressed the data and then gave it to other people because they thought that it was for the greater good.
And what happened?
Or the FDA didn't want to say that
Yeah,
these kids got sick. Some of them
Yeah.
died. Did you hear that before, Alan?
Nope,
Okay.
So is that,
that's a new one.
something like this, to be afraid to be vaccinated?
Well, I think that's,
Emergency use wasn't good enough for them.
well, in Baltimore, Maryland, they decided to roll out COVID vaccine, but they rolled it out to low-income communities first. And guess what? None of them would take it. And they all said the same thing. Hell no. We heard this game before, and we are not taking that vaccine. Isn't that crazy? And I actually think they had a valid argument. Why are you giving it to us first? Let the rich folk get it.
Then it got magnified by people.
Oh, right. Well, they said
was in
that with the,
Baltimore? It's so interesting because in Oregon it was the other way around.
what do you mean?
I don't know, other way around, but I mean, like, all the medical workers got it first, no?
Well, they did, medical workers got it first, but then
Yeah.
the general population, they rolled it out first to the low income people.
And they didn't want it.
And all of the wealthy people went to those communities and got
I mean-
their vaccine.
I was one of the first non-medical, I mean, like, I kind of got it under being a mole, but I mean, like,
You're medical.
it was a really, you know, I was in line, you know, and it was like these people from the old age home, and it was me. It was like, I was like the few younger, you know, under 50-year-olds at receiving it was either nurses, doctors, or the elderly, and then, but I was, you know, like I was, you know, it was a question of like, should I take it or should I not? And like, in the way a doctor friend of mine said, he said, if he said, I think he was like, if every doctor dies because of the COVID vaccine, it's not a planet that you want to be on.
Right,
Like,
exactly.
So this is a case that I just recently heard of, that in a hospital there were a number of newborns that were that got sick from a certain bacteria, and they were not sure what it was. There was some sort of virus going through the hospital, so they were treated with two types of antibiotics. They're giving all these newborns types of antibiotics, and they found that the ones that were most seriously ill with this virus, the antibiotics were causing the kidneys to fail. So the question was, if they take them completely off antibiotics, then they're definitely not going to fight. It's really not going to fight the bacteria. It's not going to fight the virus. So the one said, take one baby off one antibiotic, the other baby off the other antibiotic, and see which baby survives, and then they'll know which antibiotic is effective and which one
How do you
is
choose?
not. And that was a question: how do you choose?
How do you choose?
How do you choose? First of all, is that ethical? And what do you tell the parents? If you tell parents,
But each of them have an equal chance of surviving. Each baby.
each baby, without had they taken off had they taken away the antibiotics, they would have died. They would have died. Had they left them with both antibiotics, also would have died. They would have died faster. The question is,
Mhm.
what do you do? And do you tell the parents? And do you tell the parents that we're doing an experiment and that there's another baby that is that has the other way around?
I have no idea. Wow.
And you don't know which one is gonna die.
So what did they do?
They did that.
They did
They
it.
flipped the coin.
Did they tell it? They flipped a coin?
They flipped the coin.
And did they tell the parents?
They didn't tell the parents.
They
told
didn't?
the parents that this is. They told each parent this is the most effective way of treating this way, and we're going to take this antibiotic. They told them. They told them.
Wow.
Is that your
Well, I've-
business?
And one day. No, it's
So I will tell you, there's something fascinating actually for pediatrics. The ethics of pediatrics is informed treatment, not informed consent. So let's say a family has sickle cell disease and the baby is born with sickle cell disease and the baby's a premature baby. Oh, no, I'm so sorry. Let me go back. Let's say a family's Jehovah Witness. Okay. They have a premature baby who's born at, let's say, 32 weeks, right? So this is a teeny little baby, but the baby has to go to the neonatal ICU and isn't doing great. But every blood draw, the 3 cc's that you take on these babies is half of their bloodstream. So they always end up needing transfusions. So what happens if the family says, we believe that we will go to hell if we get a blood transfusion, because Jehovah Witnesses won't get a blood transfusion. Yeah. So what happens is they have a teeny little baby. Are they allowed to impart their religious decisions on their baby? So this actually went to court. And this is why we have something called informed treatment. A family's religion can't impact a child if there's a known treatment that can treat them. And so the baby had to have blood transfusions and the parents just had to deal with it, even though they felt that they were down.
And did the baby.
If they were an adult though, they could make the decision not to have their own blood transfusion, but the baby can't have that happen.
That's interesting.
You know, something that came up to me, came up over here when you were talking about what you do in your work, was I'm actually curious to know, does it make a difference if it's to improve a life or it's to save a life? Does it make a difference if for example, can I undergo medical research
That is a very fascinating
in
question,
order to save a life or to improve?
because a lot of my research is actually on things that won't kill you, right? Like,
It's really big money.
like migraines or anxiety.
Okay,
How do we, right? So those aren't things that are gonna necessarily kill you, but we certainly look for better treatments for psychiatric disease. We look for better treatments for migraines. We look for better treatments for Parkinson's, right? They might not necessarily imminently kill you.
because what,
We do that a lot, actually.
Right.
Is it true that you're like Christian Science or one of those other religions that would be at the base of this is the way to deny treatment is not to let the medical personnel at them. or
Right.
That would be a Christian Science would be one of them.
They wouldn't go to the hospital.
What about the Tom Cruise?
Yeah,
Scientology?
that's Scientology. I don't know. I don't know that one. So that's a very good question. Do you think that halacha would be different if it's not imminent death and it's just quality of life?
you know, I just find it.
Like
hard.
if I came to you and
Isn't
said,
it true?
I have migraines,
Right.
nothing's worked for me.
Yeah.
Rabbi, I think I need this new medication. Can I try it? It's very experimental.
I just don't understand. Well, the Torah says you're allowed to go to doctors, right? So doctors, in my understanding is doctors comes through medical research or scientific research, and that has to be done. So what are we going to say? We're going to say Jews wait for everyone else to get the research done and then go and apply it, or create some sort of standard and ensure that that research is done in a healthy way in order to bring it across. I'm of the understanding of like
I like that thing.
that it just needs to be a healthy standard of how to do medical research.
Or the other way to look at it is a physician makes the best decision they can based on the information they have at the time. Right? If you're an ethical doctor, you're gonna look at the data, the compounds, the history, the patient in front of you. All those things have to play a part when you're making decisions.
Yes, you're saying, yeah, now it has to be with informed consent.
Right,
The person. is
exactly.
consenting. So that makes a big difference.
Right. So now the question is, it's one thing if you've got a patient that is sick. The other thing, what we're really trying to evaluate is someone who's very healthy. can undergo experimentation in order to see if a medication or a drug will have an efficacy. Will it be effective? First of all, would it be effective to save a life? B, would it be effective to improve quality of life?
And
Right. A migraine's not life-threatening, other than potential things, something like a suicide. So maybe that's different than if someone said there's a new cancer drug. Can I take it? Asking the same rabbi, there's a difference between the two. One's life-threatening and one isn't.
Right. I think it's interesting to think about it that way.
Right.
Is there a precedent
What?
that you know of?
No, it definitely is a precedent with regards to life threatening. There's a mitzvah to save a life.
Right. So
the
the
real question
cancer ones make sense, right? From a
Yeah.
Jewish law perspective.
The real question is improvement of life.
Yeah.
So I understand that you're doing research on healthy people,
My research is on healthy people.
people to see if there's any negative effects.
Yeah.
But it doesn't address if there's any positive effects because. they're not
There's
sick.
none. When I consent them, they have to be of sound mind. They have to be intelligent enough to understand what I'm doing. And they have to understand that there is zero health benefit to themselves, which makes it really ethically cloudy.
No, I mean, I would, and like how, like, can one take money in order to do that?
Well, so that's also
Is
a
that
good,
appropriate? And who evaluates how much money to pay? I would. think
there's a
that your company-
standard in the United States.
Who sets that?
That is a very good question. It's historic. So basically it's like over time, there's something called a central IRB. It's an internal review board that tells us if it's an appropriate amount of money and if it's an appropriate consent and if it's an appropriate population. So they evaluated it and all of us, we follow something called, yeah, it's a review board. So we also have set guidelines, something called good clinical practice, which was, there's like an international council that developed this program for how we develop research protocols and if they're ethical. So we definitely don't do it in a vacuum.
It would come across to me is that, I mean, if an individual is giving their consent, unless, there is something so definitively from the halakha standpoint that you absolutely cannot do this, I would think it should be left up to the individual. I mean, if they feel something, migraine headaches are not a blessed thing to live with.
No, but what if they're
Yeah.
totally healthy? You think a totally healthy Jew can go to my unit?
Well, is there a reason that they can't?
Because there is potential harm.
Yeah.
The halakha.
I guess
But there's
the
also
question-
potential financial gain, right? So some of these people come, they're not, they are definitely there for financial gain. We've had some women came recently, 26 days, they live with us, they made $12,000.
Wow.
It's a lot of
How
money.
many of your patients are Jewish?
Zero.
I think that answers it, that not, they may be, the question is not, are they allowed or not allowed? But the question is, they're smart enough not to do it.
You're saying they have a cup, right? Just like there's no football teams on any Jewish school, right? That's like a similar scenario, right?
Yep, same thing.
Never have a Jewish school that has a football team.
I mean, it really kind of boils down to, are you allowed to put yourself in a potential danger in order to potentially save another life? Another life, not your own life.
Right.
So someone else's life.
in the
And-
future, in
in the
10 years in the future.
And not only that, can you take money for that? I find it hard to believe that it's appropriate to take money for that. I just,
So here's the thing, right? So let's
I-
say somebody's poor.
I understand.
Being poor is in Judaism, it could be considered also close to death.
There were a couple that I'm aware of that used to go every month or every 2 weeks. They would go and they'd
Give their blood,
not give their blood, but they'd have their
plasma.
plasma harvested from their blood, and that was part of their income. That was part of their monthly.
They're often, they're taking a risk.
I think it's a big risk.
Taking
And
a
it's
risk.
not such a big risk though.
Well, I mean, there's some
Plasma?
risks, so
Harvest
they're
the
taking
plasma.
a risk and therefore they're getting paid. And so,
Right, I mean, look. If you know that having a specific experimental procedure will allow your family to eat for another 3 months. And
Okay.
you happen to be Jewish.
Yeah.
Is it ethical? Is it halakhically permissible?
So I want to bring out, and this I know that DeeDee did not like it at all.
What,
Chizkiyahu. So
I
here's
can't
what-
stand it. We'll hear what everybody else thinks.
Okay, Chizkiyahu is there's more in Psachim, and it's also in a Mishnah. So it tells us that King Chizkiyahu, he was the great grandson of King David, and he was the king of the Jewish nation. He initiated 3 actions. One of them was that he hid away the book of cures, and which means that the Jewish nation, they had a book supposedly written, authored by King Solomon, and inside this book, what was the book of cures? Rashi explains that this book enabled people to cure any ailment instantaneously. So he chose to hide the book. Such a book needed to be hidden because sickness has its place in a divine scheme of things. Ill health reminds us of our human frailty and turns our attention back to Hashem. Therefore, when the ability to instantly restore good health counteracted the religious benefits of sickness, Chizkiyahu removed the book of cures. So what he did was, he felt that people, when they got sick, they were not doing a self-evaluation about where am I standing, with regards to my spiritual growth, how am I behaving, and they're immediately turning, what's the book of cures say, and then go and deal with it, right? And go and get an instant cure. And Chizkiyahu felt that was inappropriate
I hate
to do
this.
that. I want to argue, but I mean, like, imagine, I mean, doctors,
Was what he was doing, was that ethical?
was that ethical? Right, I know, and our sages approved of his behavior. Chachamim, agreed on that.
But I think Rambam's explanation makes
Okay.
sense to me.
I want to argue, and let me argue
Okay.
this, right? If a person is on a, I mean, there are 2 ways of, I'm sure doctors get frustrated, and you can tell me how you feel. Do doctors not get frustrated with people who have unhealthy lifestyles and are constantly looking for cures rather than evaluating their lifestyle?
Yeah, it is frustrating.
So why is it not a problem to,
Doc, I cough all the time. Well, you smoke a pack a day.
right?
Stop smoking a pack a day.
Well, and what do? You have no choice. You have to give them a medicine,
Right.
right?
Or I help support their change in habit.
Well, okay. So the Rambam, in his commentary on the Mishnah, the Rambam offers 2 other interpretations. Perhaps the book described healing based on pagan practices. So it was pagan practice healing. So therefore, we have idol worship going on over there, which would violate a biblical prohibition. The Jews had such a book because one is allowed to study this type of material in a purely theoretical way. Once some of them began to actually use the practices in the book to treat illnesses, it needed to be taken away. That's the one opinion of the Rambam. It's interesting, the Rambam was a doctor.
That's why I find his
alternatively-
explanation to be,
Rambam suggests that the book may have been an encyclopedia of poisons and antidotes And the problem was that people began to make extensive use of sections describing poisons. According to both Rambam's view, the problem has nothing to do with the human medicinal success getting in the way of the divine plan.
Oh. See, I like Ramam's explanation because I feel like he's basically saying we are supposed to treat people. We shouldn't treat people if it is done in witchcraft, because that's paganism and witchcraft and bad for the Jews. Even if it's effective, it's still witchcraft and not real science, right? But then his second one also makes sense to me, right? Because like there's a crazy like homeopathy, actually. Do you know homeopathy
Yes.
is can be very useful. But
Seriously, you can actually quote that.
I think I think some people believe in it
I know.
and some people believe it has therapeutic benefits. But what's the idea behind it? Do you know? Do you guys know? So it's actually crazy. It is basically that if you have a symptom and you take a toxin that mimics the symptom in 1/10,000th of a dose, that your body will then counteract the symptom because of the toxin. That's actually, and that's essentially what Ramam's saying. That this book had poisons and then treatments and antidotes, and they're using it in a negative way, right? But that is the idea behind homeopathy.
It's a little similar to what's called prolotherapy. That if you have like problems with the shoulder and it's plain, but the body doesn't recognize it as an emergency. So you inject the stuff
Right, to cause an inflammatory reaction.
Oh, really?
Exactly. Exactly.
That also could-
Kind of. Yeah,
I mean, isn't that also
that's also vaccines though.
vaccines?
Vaccines are similar in a way because the early vaccines, especially smallpox, right? What they did was they took cowpox, Jenner took cowpox and injected it into you so that you would mount a reaction to cowpox and therefore then have a immunity to smallpox. So,
Okay. Anything else?
but the
Okay.
reason it gets under my skin is because I feel that Judaism does believe that we need to access medical care and good medical care.
And I think Rashi is arguing from the perspective of instantaneous healing.
What do you mean?
Instantaneous healing is the issue.
Mhm.
It's not going through any process
It's not through a scientific process, an exam, anything.
or
It's
personal
magic,
evaluation.
right?
Of
Who put this book together?
King Solomon, apparently.
Uh,
Hmm.
I'm so happy that this microphone works, by the way. Anyways,
I have, we started out early about, excuse me, experimentation. What about usage of, excuse me, cadavers in first year med school research? What
Love
the luck there? They're obviously not a lot, weren't killed. But they're, you are dissecting a human body.
you're looking at me. I honestly, I don't know. I mean, I really don't know because every two.
I feel that
medical
you need
students
it.
Get a body, right? You can't do it
Five
that
of
way.
us have a
Five,
body.
get a body.
It depends on the school, truthfully. It depends on the availability. I had the most amazing experience, actually. It was me and 4 women. We were all different cultures and all different religions. One was from Russia, one was from Korea, one was from upstate New York, came over like in Plymouth, right? And me and somebody from Colombia, the country, like a Hispanic woman. We were dissecting the body and I thought it for my purposes, I think it's intrinsically necessary to my becoming a surgeon. I had to do it. I had to be able to cut tissue in order to do that and get through med school. I don't know. Today we have a lot.
We're not getting this. It's kind of you had interference. Try again.
Oh, okay. So I was saying that in medical school, it was me and there were 5 of us at a
Oh,
table.
that we got.
Okay.
At the end, you were saying, my feeling is,
Oh, my feeling is that it is intrinsically necessary for a physician, especially one going into surgery, to have a body, right? So we were all dissecting, and we had a female body, and we took the heart out, and we were holding it. And as we were doing that, first, before we even started our anatomy lab, we actually had a ceremony saying we need to deeply respect these bodies because they are helping us save other people, right? So we gave the bodies their due, right? And then we had the heart in our hand, and somehow somebody asked the question, do you believe in a soul? And so each of us, we were standing there dissecting his body, thinking about it. Each of us kind of took turns holding the heart and having a discussion of what each of us felt was a soul. Where is the soul? Do you believe in a soul? It was actually a really religious and surreal experience.
yeah.
Happy
I was with 3 guys and we were all eating our lunch and talking about it. So it wasn't quite the same.
Yeah.
In there's a movie called Chinese Doctors. I told you about it, where they recreate what was the city that COVID broke out of?
Shang, province, something province,
Something one.
yeah,
Wuhan.
Wuhan province,
Right.
right?
So they recreated Wuhan's reactivity to COVID. They recreated. It's a Chinese-made movie, so there's a lot of drama, and it is very fascinating to see how they turned a stadium into an active hospital and how they reacted. And at some point in time, you see them going through the responsibility of needing to cut up a cadaver in order to do the research. And what they have was, they have the body in front of them, and the entire medical, the surgery staff, they all stand there, they bow, express their gratitude, and request for forgiveness for what they're about to do.
Oh.
And then they go ahead and do it. It was just an interesting way of how seriously they took
That respect of the dead
respect
body.
of their body.
Wow.
It was fascinating. Okay. Shall we end over there?
Yeah, interesting talk though, right?
Yep.
It was great.
It was great. Thank you, guys.
Okay, I think we do have one more day. Are you okay?
Yeah.
Yeah,
We have one
we do have a date.
after Sukkot.
After Sukkot, I think it's in November then. Has to be because I'm going in October.
I don't know. The next one we were gonna do was selling organs for profit.
There's
The
a
next one
date.
here is
there's a-
the next one on here is October 23rd.
Yeah.
Okay.
I don't know that's I cannot make that because I'm on my way to Israel. I'm in Israel during that one.
October 23rd?
Yeah.
Okay, we better not have that then.
And I'm not available the 30th.
I'm not back to
Cause Eve, oh, she's not on anymore. Okay.
what is it?
The town on the 30th. Nisa Phelps might be
Nisa.
coming to
Oh,
visit me
got it.
on the 30th. So I guess we'll have to do
So
November.
when's November? What's the dates in November?
We've been doing it the second weekend of the month. I mean, we jiggled it when we had to, based on holidays.
We have nothing on in November. The last one we have scheduled according to the master calendar, is in October.
Okay, so then, does anybody have a topic they're really interested in us talking about?
This was fascinating.
Everyone's good. You guys choose.
It's
You haven't
good.
gone around yet.
You know what?
How do we get more people to join in?
I'm fine with it, profiting from organ donation.
Yeah, I love that.
You know
But
what?
how
I
do we get more interested, more people interested?
medical history. I love like the story of how we got here. So that would be like November 13th. Do you care if he was away? Okay.
And 7:30, okay? November 13th.
Hang on,
November 13th.
hang on.
And I
No.
also, I might not see you all, but if I don't, I want you all to have a Shana Tova.
Very same to you.
You
And-
too, Doctor.
I'm
You
going
too.
back.
All of you.
Yeah, but thank you so much for everything. Just being involved in the center has meant so much for me over the last year. So thank you.
And having you involved has meant so much to all of us. But we need to get more people on in these classes.
I know, I actually put one of them on the Jewish Resource Committee at AbbVie. We have a site on we have a team. And so I would be happy to put it on as soon as we have like information about the time and the topic. I can try to put it in there.
That'd be great. That'd be great. We have to figure out a way to promote this more because it's so valuable.
It is
People would
so-
love, people would love it.
Going out into publications. So that, you know, the neighborhood, community is aware about what's happening here.
We certainly put on North Shore Jewish Moms. You're going to be running into, I mean, not that it would matter one bit to me, but it will to some, football games all Sundays.
Oh, yeah.
I mean, tonight was a Bears game, so I'm sure
I
maybe.
did know about it. Please do not tell me any scores. Please don't.
DeeDee, I wouldn't know a score if I heard it.
Okay,
So-
good, because I have been avoiding any scores.
Somebody always tends to blurt it out.
Please
From
don't.
which perspective?
I'm not telling you which one. The Ravens, the
I'm
Ravens.
saying you care about it.
I care deeply about watching it.
The orchestra rehearsal, the concert master stood up and said, in case anybody wants to know the Bears score today.
That's
just-
terrible. That's a horrible thing to do. Such a spoiler.
All right, well, thank you very much.
Good to see you guys.
Yeah,
Ravens versus.
Shana Tova.
Okay, shout out to everyone.
Don't
Thank
tell
you.
me.
Bye.
Bye, guys.
Bye.
Thanks, DeeDee. Thanks for Rabbi Gadi.
Thank you.
Because he was a doctor and religious.
I know,
You got
I'm a big
balance.